Welcome back. This is Steph from Cold Blooded Freaks, and in today's episode, we are going to be talking about some helpful tips that I have learned along the ways of being a vet tech for many years now. I am now retired, but I'm going to share some of the tips and tricks of taking care of some minor medical issues that you may experience in your collections. Before we get into the details, I do want to express that anytime your reptile is experiencing a medical issue, it is best to go to your veterinarian. The tips that I'm about to give you are for more of the minor issues that you may run into, or even if you catch something early and you just need to be able to kind of combat it or at least try some sort of treatment before it gets out of hand and before you're able to even get a vet, because some people can't even get an appointment super quickly because there's not necessarily emergency exotic vets available everywhere. And in some areas, there's not even exotic vets that are even known of. So I'm just going to give you some minor helpful stuff. Again, not a doctor, but just expressing some of the things that I have learned from some wonderful vets that I've worked for the years. The first thing that we are going to talk about is something that is common in pretty much all snakes. This is the potential for scale rot. Scale rot could show itself on the belly scales, which is the most common, but it can also show itself on the back of the animal, kind of in spots and blotches, if you will. And usually this is caused by too much humidity in the enclosure, which is something that we did experience a couple years ago with a couple of our actual very young snakes. We had them on the cocoa chip and it wasn't working for us because it kept on causing these minor little brown spots that I just didn't like. And every single one of them got treated the same way and it cleared up very quickly. So I'm just going to give you some tips on how to get rid of scale rot and treat it so that it doesn't turn into infection or get worse. The first step with scale rot is to get rid of all your bedding that is in that enclosure with that animal, because that enclosure is probably too damp, hence the scale rot. So you want to be able to take that all out, and usually I wipe that down with water and Dawn soap mix so that you can clean that all up and make sure it's nice and dry afterwards. And then you could put some paper towel down so that just the air in the enclosure itself could be absorbed a little bit more by that paper towel. And if the animal goes pee or anything like that, you want that all absorbed as well so that you're not adding any more to the humidity in there. So with that said, once you have that done, you get to the treatment of your animal. So a lot of people I've noticed tend to want to put Neosporin on their reptiles. I wouldn't necessarily recommend Neosporin because they don't have the same kind of skin that we do. And I've also seen people that almost pick at the scale rot, trying to lift it away from the animal. In my experience, I just leave it alone. I take a little bit of betadine and I mix it in a very small bowl with water. So you want it to be the same color of, say, a light tea, if you will. So not as dark as this bottle, but you want to go a little bit lighter, okay? And then we would take a Q-tip, dip it into that water, and then actually apply that diluted mix to those spots so that it can kind of heal up, if you will, so that there wouldn't be any irritated skin underneath that or any more spreading going on. Betadine is something that I do think that everybody should have in your collection, if in your arsenal, if you will, for your collection, so that you can treat some minor things that we will keep talking about as we go here. But once you do that treatment, it should be able to at least combat it from spreading. And once the animal goes through another shed cycle, you will see that scale rot lift. Depending on the level of the scale rot, it should lift the first shed, or it may lift the second shed, or third, depends on how deep it goes. But you can see actually a loss of scale sometimes from scale rot. So just things to keep in mind, but you don't have to do this treatment every single day. I would say every other day works fine for us, and we only did it for about a week until that animal went into a shed cycle. Let it go into its shed cycle like normal. It shed and the scale rot was gone. Another tip with scale rot is, obviously in some enclosures we have these bowls that are not necessarily stable, and the animal can go inside the bowl and flip it over and then make the enclosure humid all over again, kind of swampy, if you will. So we don't want that to happen. So another recommendation that I would also say to do is to get a very small bowl with a very small amount of water and keep it in the corner of the enclosure if you don't have any of the bins that have these steady bowl systems, just so that you don't get any extra humidity happening. And you don't necessarily want the animal to soak itself during this time, because obviously scale rot is due to too much humidity. Moving on to something that you may experience if you feed live rodents to your reptiles, and that would be a rodent bite. Now, again, I do want to really, really harp on the fact that this is only for minor injuries. This is not for really deep cuts that where flesh is lifting up or anything like that, or there's an actual really deep hole. This is for minor injuries. So if you have an animal that even strikes and consumes a live rodent, that rodent can potentially bite somewhere on the body while it is being constricted and cause a minor puncture, a minor cut, if you will, on the animal. And I don't like to leave those alone. Again, this diluted combination of betadine to a very loose, like a light tea coloration in a bowl with water and a Q-tip just to apply it, that's all you really need. But I would do that more than every other day. For this one, I would probably do it every day until you really see that starting to heal up. And eventually the animal will shed, and you'll be left with potentially a little scar that may kind of get smaller over time. Another tip with betadine is that it does stain your clothes, and it can stain anything that's light colored. So you don't necessarily want to spill this or, get it on yourself. It's not going to hurt you or anything. It will eventually come off your skin, but you might have a little bit of a stain for about 24 hours. Moving on to something else that does not require betadine. We are talking about the potential of respiratory infections. This is a definite go to your vet. You need antibiotics for this. But if you're not able to get to the vet right away, this is what I would recommend doing. Take everything out of the enclosure, put the animal on a paper towel. Everything is dry, because respiratory infections are usually caused by a cool or a drop in temperature with humidity. Perfect combination for respiratory infection. And usually this may happen to some of your younger ball pythons or snakes, or some of your older ones, or even ones that are under distress, such as your breeder males during breeding season. So something to keep in mind is listen to the way they breathe. If you ever hear your snake kind of, that's not a good noise. You don't want your snake breathing like that. If there's any swelling around the facial area under the chin area, also not good. Any swelling at the top of the nose, very not good. Fluid coming out, that's very bad. But the first things first, if you cannot get to a vet right away, take everything out of that enclosure. And this is where I would do a very small amount, maybe, and it's just, I do literally a tablespoon of bleach to a gallon of water with Dawn soap, and I scrub that enclosure. That animal gets moved to quarantine, and that enclosure gets scrubbed, and the temperatures are kept very steady. There is a very, very small water bowl that is put into the enclosure only for the need for drinking. And I'm talking a like tea light size bowl, very small, nothing big. You don't want that animal soaking. You don't want humidity in there. I don't care if they're in the middle of a shed. It needs to dry out. Respiratory infections do not do well in dry environments. They thrive in humid environments. So you definitely want to dry that situation out as fast as you can to help that animal feel better, quicker, and breathe, because respiratory infections affect their breathing, which is essential for their life. So if it gets out of hand, they can pass away. So it's not something that you want to wait to treat. You want to start treating immediately and call your vet so that they can get your pet onto an injectable antibiotic that you may have to do yourself, but they can teach you the steps along the way to do that. Another topic I want to talk about is something that a veterinarian told me once about chronic regurgitation for snakes. For some reason, when I personally experienced this only once so far, but I've had a snake that would just constantly eat, regurgitate, no matter how I would stop feeding them, skip a meal, try a smaller meal, nothing was working. My veterinarian told me that the best thing to do is to take that animal out of its normal environment, completely change the substrate. So again, I put this animal onto paper towel, which seems to be my go-to when there's anything going on with an animal, so I can monitor everything better. So I put that animal on paper towel and I left it alone completely. I gave it water and that was it. I changed its bedding, obviously, if it went to the bathroom or anything, but it really didn't do much because it wasn't eating. And I completely left it alone, and I blacked out the bin and kept it in a very quiet area of my reptile room. I didn't offer it food for about 3 weeks. So that's 3 meals that I did not give it, because we feed once a week. So I skipped 3 meals, and that seemed to do the trick, because after that I offered a very, very small meal, which in this case I believe was a rat pinky. And then I went from a rat pinky to a mouse, small mouse, and then I kind of kept on going up from there. And that animal did great with that. I don't know if this will work for everybody since I don't have the vast experience in chronic regurging, but I do see and hear about people having issues with a snake that just will not keep a meal down. And this worked very well for us. And even if we have an animal that regurgitated once for us, we take bedding out, we put paper towel down, we leave it alone, we skip a feeding, and we go to feed the following feeding day. And that animal tends to do very well. So just something I learned that, again, might not be 100%, but can certainly maybe help the spiral of them chronically regurgitating on you. Moving on to another scenario that you may see. This you may see more towards breeding season for some of your males. I have not really seen it much in any of my females, but I do recall having 2 males that this has happened to in the last few years, if you will. Their vent area is where they reproduce, they go to the bathroom, they can lay eggs, all the things come out from down there. So with that said, during the courtship, if you will, that they do with their female, the male will actually open that up, that vent up a little bit, and drag it on the ground. And depending on your substrate that you have, it's a possibility that that substrate can irritate that very, very delicate, fleshy skin that is within that area. If that does indeed happen, you'll see almost a kind of crusty look. It almost looks like scale rot, but it's inflammation caused by internal inflammation. And it's just irritated area, and definitely definitely call your vet, because these little things can turn into internal infections that you cannot treat topically. But I would recommend soaking that area in warm, diluted with betadine water multiple times before you're able to get it to the vet. So if you call and you're able to get the appointment the next day, at least soak it 3 times that day before, because they're going to be able to give you antibiotics that can go probably under the skin for the snake, because most reptiles don't take medications by mouth very nicely, so they usually will do an injection. This will at least start treating it from the outside a little bit, and hopefully keeping some of that swelling down, and hopefully keeping the infection from actually spreading. But this is definitely something to keep in mind during those breeding seasons. Always be checking your boys, check your females. It's always good to just overall check your snakes to make sure there's nothing going on. But this little infection back there can actually kill your reptile. I have seen, unfortunately, some patients that used to come into the vet have this happen, and then the animal, unfortunately, it was too late because they waited too long and they didn't do this betadine treatment beforehand, and the animal would succumb to the infection. And I don't want to see that happen to anybody else. So I would like everybody to have this. I can't hype this enough. Please get betadine if you don't have it. Something else to consider if you do run into this vent inflammation: take the animal off its bedding. Get rid of any substrate that's in there. Really clean that enclosure, soap and water. Make sure it's super, super clean, and then apply paper towel. You can even add a little bit of that diluted water betadine tea mix, as I call it, onto that paper towel, just in case, if it is laying down and it's able to kind of lay its vent on that. It's just adding to help, prevent any more infection from spreading. So just little things that you can do to help the animal feel a little bit better too, and also not to have it keep getting worse. Moving on to another scenario, since we are on the betadine talk here, there is something else that you can use betadine for. And this is if you ever have had, it could be a ball python, it could be even a bearded dragon. They can get injuries in their mouths. They can get injuries in their mouths from their food items. They can get injuries from biting, potentially when they eat food and they bring their substrate into their mouth and they might get a splinter. They can literally have a broken tooth from eating a rodent or things like that. There's so many different combinations of injuries that they can have in their mouths. And you could see a swelling. Usually, in this case, it would be towards the front of the mouth area. And when you open up the lip area, you'll see some red inflammation of the gums. Now, again, I do preface this with, you should call a vet, but if you want to treat it, say it's nighttime that you're seeing this, and you're like, I got to do something now so it doesn't get worse, I definitely recommend at least doing this and making your appointment to go see your veterinarian to get this looked at. But in this case, we had an animal that did get substrate stuck in its mouth and actually caused a minor laceration to the gum line and broke a tooth. So it had multiple things going on with it. It had a tooth root infection as well as a puncture wound inside of its mouth. So again, we took the betadine and did the tea mixture and applied it. It was very difficult, but you do have to be able to open their mouth and be able to apply it to their mouth. The only thing I would not say to do is use a cotton ball or a Q-tip in this case, because the cotton fibers like to get stuck to the teeth area, and then you kind of have this annoying mess of things happening. So I would recommend using a paper towel and dipping it in and then lightly dabbing that area just until you see that tea mixture kind of just laying there, and then you could kind of let the animal relax for a little while. But I would try to do that every day until you're able to get into your vet's office to get that looked at. Last thing that we were talking about is the importance of deworming. Now, this is not necessarily something for if you're breeding snakes that are captive bred or anything like that, but this is for if you are picking up an animal that might be wild caught. So being in the vet world for years, we would get tons of people that would bring in animals from pet stores or expos or wherever, honestly, Craigslist sometimes, and the animal would be eating, but it's not gaining any weight. So the concern there is there a parasitic load? So you have chameleons that this will happen to, bearded dragons, leopard geckos, mainly the lizard variety of reptiles, but it can happen to any reptile realistically. So treating it for deworming the animal is super important. And there's even some cases where I saw that bearded dragons that were specifically on cricket diets, because I don't know why people at pet stores sometimes tell people that all a bearded dragon needs is crickets and lettuce, but it is what it is. Those animals would end up having extremely high levels of coccidia in their body, which is an intestinal parasite that saps all the nutrients from them. And basically, they're eating for them and many other little buggies inside them. And this beautiful substance, if you will, this little mix here, I have been able to save some wild caught animals. I've been able to save some rescues because I did years of rescuing reptiles. Tons of animals came in, and I needed to use this very quickly so that I can at least eliminate the parasitic load that was going on in their body that was malnourishing them, if you will. So something to consider is that if you do get an animal, it's not going to hurt them to just do this. There are more aggressive dewormers out there that you can get from your veterinarian, but this is an over-the-counter one that seems to work very well for me in my experience and hasn't harmed anything. If you follow the directions on it, you should be totally fine. I recently had to use this on a Uromastic that was wild caught, and he was not doing well, and I was able to syringe this. It was kind of difficult, but I was able to syringe this into his mouth, and it did save his life, and he is doing great now from what I know. So definitely something to keep in your arsenal if you do get more than just captive bred animals, or if you're taking in someone else's pet that you don't know how it was cared for. This is Nature Zone Worm Guard for control of intestinal worms and parasites. It says it works effectively and naturally, and I can tell you for experience, it definitely works. I really hope you guys enjoyed this episode, and keep in mind, like I said a billion times in this episode, your best thing to do is always seek a veterinarian for assistance and any issues that you're having with your reptile, because you never know how bad something actually is if it's just surface level. So it's good to get them checked out. But these are always good things to have in your arsenal if you ever do run into an issue. In the comments below, feel free to ask me any questions that you may have. I would love to help you. And again, I'm not a veterinarian. I was just a vet tech for over 10 years, so I do have some experience that I can maybe help you with, but I'm not a doctor, so I cannot give you medical advice. I could just give you helpful tips and tricks that I have learned along the ways. Don't forget to like and subscribe. We are really trying to get to 900 subscribers, so we would really appreciate it. We will see you next time.